Hi, Allison.
How are
Well,
you? It's so nice to meet you.
nice to meet you too. And how do you say your last name?
Shrikhande.
Oh, well, I had it all wrong.
No, I know many people, it can be challenging. So it's Allyson Shrikhande.
Shrikhande. Got it. That would
Yeah.
have been my last guess.
Okay. Well, I'm so excited to do an Instagram live with you, and I'm just so impressed with how brave you've been, just really getting it out there. These, intimate symptoms, and this is what we need all women to do, right? To just break this cycle of silence, and it's exactly what we need. So thank you for leading the charge. And I'm just really impressed with everything you've done.
Oh, that means a lot to me to have you say that. And can you hear me okay? Is the mic all right, or should I put in my earbuds? Or
I can hear you. Can you hear
okay,
me?
I can hear you great.
Great, great. So I just want to open up. Just really, I would love you to tell me about your journey. Like how it, even just from the beginning, because we need to educate the population on your story and just how it all started. And
Yeah, I think the clearest part of the clearest part of my journey is just that from the very first time I ever had intercourse, I noticed that it hurt quite a bit, but I kept it to myself because I figured, oh, well, everybody says it hurts the first time. I didn't feel it hurting in terms of it being like tight. I just felt it like stinging and burning, and I couldn't really understand that. And as I went through, a few more years and into my 20s with that, it started occurring to me that maybe not everybody was feeling this, really pretty intense burning and stinging around the entrance of their vagina every time they had intercourse. And my girlfriends were like, no, I don't feel that. I'm like, wow, I really do. And I started trying to figure out what was wrong, asking gynecologists. And I would go through numerous tests, like all the STD tests, all, other kinds of just being examined, and doctors I went to all over the country, just because luckily I traveled for work. I was all over the country touring with shows. So I would just hit up gynecologists in every city I was in trying to find an answer. And I was always told nothing was wrong with me. And I was left really feeling that it was just all in my head, and that it was all psychosomatic. And I couldn't understand that because the pain was so real. And I think it's really important to note, in addition to seeing doctors about all of that, I was also seeing doctors for digestive issues, thinking that it was completely separate. I had terrible digestive problems. I never went to the bathroom. I was often buckled over in pain from gastric bubbles and pains and things like that. I didn't know what was wrong with me. And I was once told, oh, if I had a nickel for every woman who came in here saying she had digestive problems. I'm like, isn't that a clue that we're not just all making it up? But
Right.
what I learned very recently is that all of it is part of pelvic dysfunction, and that the muscles of my pelvic floor are creating the digestive issues and problems. And that a lot of that is inflammation, and also creating the difficulty with the burning and stinging, also due to inflammation and tightness and everything else. And I started connecting the two. In terms of digestion, that actually made a lot of sense to me. But in terms of the burning and stinging around the entrance of my vagina, I still didn't understand. I said to the physical therapist, because I went into pelvic PT, and my first visit is when I made the link between the two, because I'm filling out the form for this vaginal PT, and it's asking me questions about my digestion and going to the bathroom. And I'm like, what does this have to do with anything? And I said, okay, well, I just don't understand why it's the pain is showing up as stinging and burning. If you say to me that I have tight pelvic floor muscles, and
Right.
if I told you that I'm experiencing a feeling of a bruise, or a feeling like I'm a dancer, so a feeling of a sore muscle or a stone or something like that, I would understand. But like feeling like a sunburn or like thousands of paper cuts, I don't understand how muscular difficulty is translating to stinging and burning. And that's when she said, nobody really quite understands, but we have overwhelming anecdotal evidence to tell us that it's true. And when she said that, when she said overwhelming evidence, I realized, oh, I'm not the only one who has this. So many women have come through gynecologists and pelvic pain specialists and pelvic pain physical therapists and have described this exact kind of pain. And that's when I decided I got to say something, because people remember me from trading spaces. They know my name, they know my face, they know who I am. And I could reach a lot of people and a lot of women and go, you're not alone. This is real. You're not crazy. So that's kind of how it all happened and unfolded.
Wow, what an amazing story. I mean, I can't tell you, because at Pelvic Rehabilitation Medicine, the most common chief complaint we do see is pain during or after intercourse. It's our most common one. But so many women have been told, have a glass of wine, relax, it's in your head. Yeah, and just really connecting the dots of the, the neurophysiology behind that nerve. It's real, and it's, and you're not alone. You're definitely not alone. I mean, definitely not.
Well, and it's hard to relax. Like, I don't want to gloss over the stress aspect of it and the past trauma aspect of, that neurological connection of mind and body is a real one. But to just tell someone to relax is not really helping anything, because it makes you think that it's just in your brain. You have to retrain your body so that your pelvic floor muscles aren't afraid every time you're about to do something, because without you even realizing it, they are constricting in such a way that's causing pain. And it's like a biofeedback loop in the worst possible way. And the way you can change that loop is through the pelvic PT. I started actually realizing that there are pelvic pain specialists, not gynecologists, but pelvic pain specialists that you can actually do physical therapy for your vagina and for your pelvic floor muscles to train them how to relax, how to be differently. It takes time. I did the whole dilator route, where you went, different sizes of dilators. And it's not about, preparing your vagina for the largest size dilator. It's about telling your vagina, something's coming in here and you're okay. And then going up a step. Okay, now something larger is coming in here and you're still okay. And going through all that relaxation process and biofeedback process. It's not just have a glass of wine and chill out.
100%. It's resetting, retraining. We are pelvic pain specialists, MDs and DOs at PRM, non-operative, and we have some operative as well. But we are all just pelvic pain. That's all we do all day. But it's reset, retrain the central nervous system, peripheral nervous system, the muscles, and the fascia. It all needs to be reset, retrained. We say you're like an iPhone. We're just rebooting you right now.
Yeah, rebooting. But it's tricky, and it takes a lot of patience. And I think one of the reasons I wanted to speak up is because you also have to get over a lot of embarrassment. I mean, it's one thing to go into your doctor for a pap smear. It's another thing to lay there for 30 minutes while someone is like manually working on the fascia inside you. And it takes a tremendous amount of trust in the person who's doing it. It takes a tremendous amount of trust that you're doing the right thing so that you don't feel violated again. It takes, or that this is just making it worse somehow. And it takes shedding all that embarrassment and all of that shame and letting someone help you and letting you help yourself. It's a huge mental obstacle. That's why I don't want to discount when doctors say relax. It's not followed up with any actual tangible way of creating that relaxation.
100%. I mean, the pelvis is your core, so it is common to hold tension there in general. And then never mind, there was some sort of trauma, whether it be, some sort of history of sexual trauma or a surgery, or even sometimes a traumatic birth, right? There's just
or even just the ongoing
pain. That's
daily and or weekly and or monthly or yearly experience of every time sex happening, it hurts, you
yeah,
know. It- it-
exactly.
it's just very difficult to be excited about it when you know it's going to end in pain.
Yes, yes, but I completely agree. But it is so common, extremely common, and speaking up is the only way we're going to start addressing it and raising awareness that there are people that can help you. There is
Yeah.
help.
I don't want people to give up. You know, if I could, well, I didn't give up, but I don't want it to take, over 30 years for somebody else, but, if someone in their 20s is facing this, I don't want them to go into hiding. For me, it also took on the mental embarrassment of like, oh, no man will love me. I'm broken. I can't really tell the truth about how much pain I'm in. I mean, my husband knew, like, there's this, it's not really correct in the People magazine article that I did. We've been together 26 years and he had no idea. That is not true. He has been fully aware, but I've kind of underplayed it a little bit, like, no, I'm okay, or I might admit on one day, oh, today it was really bad. Whereas honestly, every day it was that bad. I protected him from it because I didn't want him to have that burden. And I think I was also afraid, he'd leave,
Yeah.
So I don't want women at that tender age of 20 in this society thinking, oh, I'll never have a man who loves me because this is just never going to get better. I think it's important that you find pelvic pain specialists. And many gynecologists have recommendations for that. It's not that gynecologists don't know that it exists, but maybe women need to speak up and say, hey, do you have a recommendation for a pelvic rehabilitation specialist, a pelvic pain specialist? And they can help you find somebody in whatever area of the country you're in. But it was figuring that out was the first step. And then they can help direct you in other ways.
Yeah, no, completely agree. And how do you deal with and manage your pain now?
Well, I wish I could say it's all better. It's not. It's still an ongoing battle. Um, I believe that the thing that has helped me the very most was changing my diet, which when I do that more strictly, I do notice a bigger difference. It's kind of very similar to an autoimmune diet. I have other autoimmune issues and disorders. And so an anti-inflammatory diet is extremely similar to that. No gluten, no dairy, no sugar, and by extension, no alcohol. I still have a martini every now and then, or I might have a little goat cheese in my omelet or something like that. But I have to be really careful with that. And, you can cheat. I don't have celiac disease. I can have gluten. I'm not going to be buckled over in pain in the hospital. But I have to be really choice about when I do it. And I often pay the price. But I found that is what helped my digestion the most. And that was the biggest clue to me that, oh, these things are linked. The other thing I did once I found Dr. Kirpikar, who was my pain specialist that I went to for the pelvic pain, we did steroid injections into my pudendal nerve. So that's the actual nerve that goes to that area of your body. I thought I was going to get shots right in my vagina. I was so relieved to find out it went into my back. And so she did that. And then we also did ablations. So where she kind of lasered out the nerve. No nerve, no pain. And that helped, but it grows back. So you have to kind of do it again.
Yes, yes. That's the positive and the negative. The nerves always heal,
Yep.
which I realize that always a strong statement, but most of the time they do heal.
So I'm about to make a statement that I'm going to do in the form of a question, because is this true or is this not true? That in a way, ablations can work in the same type of way that biofeedback works, where if you don't feel the pain for a period of time, and when the nerve grows back, your brain has started to also believe you won't feel the pain. And that maybe when your nerves grow back, you won't have the pain the way you did before. Not because it's a new nerve, but because the biofeedback has changed.
Correct, because you're getting less input, right? So essentially the peripheral nerves talk through the spinal cord to your brain. So if you stop that input, then it will help calm things down. But it really does, I think, it really depends on the underlying primary pain generators.
Mm-hmm.
And for me, I've been doing, practicing pelvic pain for over 8 years now. So seen a lot of different patients. And the mistake I made 8 years ago, I think, was focusing too much on pudendal neuralgia only without really, you have to understand the root cause. Of course, the pudendal nerve is the main nerve of the pelvis, right? It is the main sensory motor nerve that S2, S3, S4, the sacral spine, and innervates from the clitoris to the anus, to the rectum and anus. So
right.
all genitalia, the perineum, but it is that main nerve, not the only one, but the main one. So it's involved in quite a lot when there is any pain in the pelvic area. But there's a lot of organ systems there, and a lot of other things that go on. So I think a lot of it is just getting to the root cause. And then you can kind of take a step back and delineate your plan. And of course, your plan is always to heal that pudendal nerve. When you really want to reset, retrain, make it live in a better environment. Less restrictions in both the fascial and the muscle, as well as less inflammation around the nerve. Of course, that's important. That's a no-brainer. But then why? Why are you there? And that's what I think is important for a medical doctor or healthcare professional to delineate how you got there, right?
I think it's important to note that the only way to delineate that, let me rephrase that. It is common that the way to delineate how the pain is starting or being instigated is also sometimes by way of deduction.
Yes.
So I think you have to be really patient, like in the same way that, say, maybe someone who maybe suffers from clinical depression or severe, mental anxiety issues, they may be trying different antidepressant pharmaceuticals, and you might not get it right the first time. You might feel worse. You might, need a different one, a different dosage, and you have to trust that you're giving information to your doctor so they can figure it out along the way and get you where you need to be. Don't give up.
Completely agree, Paige. That's exactly right. That is exactly right. And it does usually take time. We always say to our patients, nerves heal, but they're tricky, right? They heal painfully slow, but they do heal. So that is very true. And with the world of the pelvis, other than getting to that root cause and primary pain generator, sometimes there is a multi-hit hypothesis. Quite often there's a couple things going on that need to be addressed, right? Not just one thing. And then
I remember going into my doctor, and the person I've been seeing now, who I talked, Dr. Kirpikar, who I mentioned, and she just understood so viscerally, and she just was saying all the right things, and I couldn't believe that I was being heard, and I just wanted to go out of that office done better, and it didn't quite work that way. It was going to take some time, and pelvic PT, that was months.
Mm-hmm. Yeah, no, that's great that you understood that it does take time. We typically judge our progress. It's not right away. It's more
gradual.
Effect at the end. And we're working with always physiatry. We do the pudendal nerve injections externally as well, ultrasound guided, and then we have therapy who works with us always. We have behavioral health in-house, and we have an integrative nutritionist. So we believe in that comprehensive outpatient approach.
Where are you?
We're all over the country. We started off in New York City, but grown subsequently in the past 2 years. We're in 13 different locations. So we're in Miami, West Palm Beach, Dallas, Houston, Atlanta, Michigan, and Washington, D.C.
Wow.
All over the place, Chicago. So we are all over, and we're growing because there's such a need.
Yeah, that's so good to hear, because, I'm in New York City, and sometimes I try not to take for granted how much opportunity is available in a city like New York. Whereas if you're in Lincoln, Nebraska, or Salt Lake City, Utah, the doctors there are great, but sometimes those real specialists go to the larger, metropolitan areas. And so it's really good to hear how much you're branching out, because I also feel for women who are like, oh, great, Paige, thanks for all the info, you and your New York City life. What am I supposed to do? I live in Minnesota, F you, so I'm really glad to hear that it's branching out. But that, to ask your doctor specifically for pelvic pain people is the direction you want to go.
I completely agree. Yeah, because it's a complicated niche that you really have to do all day, every day, I think, to really wrap your head around it, right? Because there's not just, of course, there's the bladder issues quite often come with urinary urgency frequency. It can mimic what we call IC or interstitial cystitis. Playing with bowel movement is super common around this as well. Yep. So classically worse when you're sitting for long periods of time. So we're always prepping.
Absolutely. I'm like always just a little uncomfortable down there. I'm always aware of it. Like I wish I wasn't just constantly aware of my whole down there all the time. It's like, it's what I think about, like what I'm wearing, how long I'll have to sit, where I'll be. And then in terms of bathroom issues, like, will there be a bathroom? Will I be able to get to one? How, and those are issues that especially women as they age start facing, even if they didn't face them when they were younger. And that's all pelvic related. And a lot of people think that it's organ related or, just their urethra or just the bladder. And it's not, it's all connected. And it's just so important that women understand that. It happens to men too.
Oh, 100%. Yeah, we see women in that because we're physiatrists, so him and our docs. So yeah, we are rehab both. But you're right. Yeah, that connection, because it is almost like a silent disease process, right? I mean, there are some imaging techniques, MR neurography, EMG nerve conduction studies, but those are not very comfortable and highly, we don't do them very often. We would mostly do an MR neurography, but most of it is history, physical, and going to an knows kind of what to look for, and just making that connection. That's right. That it is nerve pain, and sometimes it's itchy, right? It can be an itchy, it can be a pressure.
Yes.
Have these nerves.
And you think, and everybody, it's so, I don't know if this is common or not. So often I would just write it off as, oh, I must have a yeast infection. Oh, it must be yeast infection. Oh, it must be yeast infection. I even had gynecologists say, well, I don't see the presence of any yeast, but it's probably a yeast infection. So I'm going to give you this, whatever prescription strength monostat or whatever. I'm like, but you just said there's no yeast. Yes, but you don't always see it. And it's obvious that's what it is. And I'm like, but is it obvious though? Because that's why I came here for the test, right? And the test says there's no yeast. So I'm really confused.
Not adding up.
Right. But we think we're trained, and we should be trained. It's a good way to think that doctors know best, that it is important to not just doubt the healthcare system and your doctors, but if you don't understand something, you should keep pressing. And it's good practice in general just to get second opinions whenever and however you can. If you're doubtful, listen to that voice. You have an instinct, and you have every right to just go to another doctor for a second opinion. If they say the same thing, well then, okay. But they might say they don't know what's wrong with you, but if they say, well, you definitely don't have a yeast infection, then you maybe keep pushing and asking more questions. You have to advocate for yourself, because doctors are also human, and they see however many patients a day, and it can be really easy to be a number, and it's not their fault per se. It's just human nature.
I completely agree. And a lot of it's just, it's a newer field, and the training is not there in medical school and residency. So it's a large reason. And it's a lot of it's a silent disease process. And so I asked about nerve pain in the abdomen.
Yeah, I just saw that.
I think the question, it's possible for sure. The main nerves there would be the ilioinguinal and iliohypogastric nerves, as well as lower down, you have the genital branch of the dental-femoral. So for sure, we evaluate, we can treat those as needed. And they can be involved in certain patients, depending again on the history and exam. They tend to be, sometimes C-section scars can cause that ilioinguinal neuralgia. And we call it anterior compartment issues. So a lot of bladder issues. If you treat those nerves, it helps calm down the bladder, that more anterior compartment.
I had some pain when my first year in college, where it turned out I had this like benign cyst on my fallopian tube. And, I was like, I fell down in the airport. It was all very dramatic. And EMTs came by, and they thought I might have appendicitis. but I didn't have a fever, and I didn't have any of the other symptoms of appendicitis except that I was buckled over in pain. So it could be gynecologically related, or
100.
or gastro related if it's in the side like that.
Yeah, I would say endometriosis is extremely prevalent and during particularly pain with intercourse, right? And associated GI symptoms as classic endometriosis. And the challenge with endo, again, there's no diagnostic. Ultrasounds are normal, often normal, and blood work. So it's a challenge to diagnose endometriosis, but it's 1 in 10 to 1 in 9 women. It's more prevalent than breast cancer. Something to always be, have on the back of your mind if you have these symptoms. And yeah, so you definitely want to see a pelvic pain expert and discuss endometriosis. That's one, again, I think sometimes 8 years ago was pushing too much pudendal neuralgia. I'm trained MSK, but really a lot of it is endometriosis, for sure. It's a lot of endo irritating that pudendal nerve, right? It's a pro-inflammatory systemic disease process, and it just spits out inflammation that will irritate the nerve, and then it also causes the muscle guarding, which then you squeeze the nerve as well, so the nerve doesn't have the blood supply. So it makes sense why endometriosis would be connected with the pudendal nerve.
Yeah, I've never quite understood endometriosis. What is it exactly?
Well, it's endometrial-like cells found outside of the uterus. So they can be found really anywhere. Most common area is the pelvic cavity. But they have, and then they go all around, and then they get inflamed, and then they heal, but they as plaques. So they cause pain, and infertility is what it presents with. Most common symptom is pain with intercourse, and then associated GI symptoms. Because you see a lot of SIBO with endometriosis, small intestine bacterial overgrowth. So we see a lot of SIBO at PRM. So we work with our integrative nutritionists, and sometimes we need a short course of antibiotics if it's diagnosed. But those often come together. So you get a lot of bloating, GI stuff. Sometimes they come with a diagnosis of IBS, but it's really endo.
My husband likes to call it EBS, explosive bowel syndrome. He has that. Somebody asked an interesting question. Did you see this one about how to tell the difference? I can't find it now. There it is. How do you know? Oh, my stars and garters. My phone is like not happening. Darn it. Like, how can you tell if it's from pelvic pain or just a UTI?
Okay.
I can't. Why is it not scrolling?
Oh, how can you know for sure the problem is spasming muscle or nerves, sending the wrong signals to the brain from a prior UTI, or both? Great question. Yeah, I mean, one way would be to culture and look and see if the urine analysis and culture show a UTI. That's a great place to start. But if that's negative, then you could exam and see how that muscle nerve function of the pelvis is doing, and if it correlates, it could be the reason. So it's history and exam, but you would want to rule out a UTI with the basic urine analysis.
Oh, sure. Always rule out the really, truly obvious things. It's just when those things get ruled out, if you're still hurting, don't stop there.
No, do not.
That's the thing. It's like, oh, well, it's not a yeast infection and it's not a UTI, so I guess it's just in my brain. I guess it's just in my mind. Mm-hmm.
Yes, and we hear that that sensation of UTI that never went away, doctor. That's very common. That's what they're saying. It just never went away. I did go through antibiotics, or the same with the yeast, that burning. And sometimes there was a real infection, sometimes not. Everyone's different, but either way, it never went away. So yes, then
right. Well, two things can be true.
Mm-hmm.
Just because I have pudendal neuralgia and I also have lichen sclerosis, which is apparent, I just found that out. And I don't know if I didn't know what it was at all, but apparently it's relatively common. But just because I have those things doesn't mean that I haven't also had a UTI or also had a yeast infection sometimes. So, you want to get those things checked out. And if it can be fixed with an antibiotic, then that's awesome. But it doesn't mean that if the pain doesn't go away, that you just stop there. Right.
And you have to the muscle nerve dysfunction that quite often correlates with those symptoms of that irritated nerve feels like a UTI, but it's not. There's no active infection inflamed. Their nerves inflamed, and the muscles quite often are in spasm. So
I think as you get older too, you get confused because, it's so easy to do, the funny joke like, oh, I passed 50, so now I spend my life on the toilet, because you just have to go to the bathroom all the time.
yeah,
But those symptoms are not always just funny or age related. They, and that's the thing. You have to make sure you know the difference.
completely agree. Yeah, there is that hormonal component that complicates things as well. But yeah, and then there was a question. Someone said they just joined and wanted you, Paige, to kind of repeat a little bit about your healing process and your journey.
Yeah, well, the symptoms that I had were for decades, stinging and burning around the entrance of my vagina, primarily when I had intercourse. It felt like the skin there was sunburned, or it felt like there were just, somebody had gone in there with a little razor and just nicked thousands and thousands and thousands of little paper cuts. And it just hurt all the time. And I just went to many doctors over the years, over the decades, looking for some answers. I did the STD tests, did the exams by numerous different doctors all around the country, and eventually ended up at a pelvic pain specialist, which is where I found out that it was the pelvic floor muscles that were creating that pain, and that I could retrain the muscles to respond and relax differently. And that has helped alleviate the pain a little bit. I also had to change my diet and go on a similar autoimmune diet, anti-inflammatory diet, and cut out gluten and dairy and sugar for the most part. I mean, I'll have a bite of birthday cake somewhere if we're celebrating, or I'll have a glass of champagne, or might have a martini, but I have to keep those things really limited. Shut up, Alexa. I have to keep those things really limited, and I have to be really careful and really pick and choose when I want to indulge. Or I pay the price. I pay the price with more stinging and burning. I pay the price with bathroom difficulties, digestive difficulties. They're all combined, which is something I never knew, that my gynecological problems were directly related to my digestive problems my whole life. I don't remember ever going to the bathroom, like having a bowel movement more than once a week. Like that was just my normal. I didn't think that was, I mean, I knew it was strange, but I just thought, oh, that's just me.
True.
And that's very uncomfortable. And then when I did have a bowel movement, it's like when I had it, it was like never knew when. And it was inevitably always at the worst possible moment, when I was running late or out with a group of friends, or outside the home, and I'm stuck in some public restroom for 40 minutes, desperately trying to go to the bathroom. I mean, that's how I spent my whole life. And then the other thing I did was I had nerve ablations to help just kind of laser out the pudendal nerve. If there's no nerve, then there tends to be not pain, but there are many nerves down there. So, it did help. It helped for a while. I'm due for another one because the nerves grow back. And so I've just been kind of managing it. And the PT that I did was a lot of it was manual, trying to actually get the walls of my pelvic floor to release the fascia released, get them to release, train them to know that they actually can relax. I have a dilator set that are just basically just they look like dildos, but they're just cylinders, and they're in different, they're very colorful, and each size is different color. And you just go up from like the teeniest to the maybe about that big or so, and just train the muscles in there to relax around that. And that all helped too, but it took a really long time. I mean, it took months, and I still battle it.
Did the diet changes resolve the digestive issues?
Yes, almost immediately, way faster than it helped any sex issues I had. I mean, within a month, I was going to the bathroom like at least once a day. I couldn't believe it. And I would just go like, oh, I guess I'll go to the bathroom now. And that was it. So I've actually been considering having surgery to remove my hemorrhoids, because no doctor would ever do it, because I would just create more. if you know if you're constantly stressing to go to the bathroom, and straining is what the word I meant, straining to go to the bathroom, you're just going to create more of them anyway. So I've been maybe wondering if I just don't know if I want to go through any more invasiveness around that area right now. I just want to maybe chill out for a while
and see how it goes. But that's great that now it's an option, because we always constipation is the enemy of the pelvic floor and the pudendal nerve. So good for you. Rid of it.
Good for me.
We're reversing the process, and that's great. I mean, with diet, and that's huge. And someone else asked, are you on any medications?
Nope. Nope. I take slippery elm, which does help, I think. I don't know, that could be in my mind too. But I think it helps to lubricate down there a little bit. So I take a lot of that. I'm constantly popping slippery elm, which just is a natural, I don't even know what that would be. It's like, it's a bark, right?
Yeah, natural.
Yeah, just natural. No, I'm not on any medications. Ever since the pandemic, we've been taking like a ton of C, a ton of D, a ton of zinc. But that's just because of the pandemic, not because we normally do that.
Got it. That's great. And are you still going to pelvic floor PT or?
No, not in person anymore, but I have the dilators at home.
Yep.
And I use them, and it's the diet and the ablations that is probably.
And what would you want others to know about your journey? If say I wish someone had told me, years ago.
Well, I wish a doctor would have told me I can help you. That's what I wish. But no, I think my biggest message is that if you're young and this is happening, you are not alone. You're not crazy. You're not weird, and you're not broken. And if you are older and you've been dealing with all this for a long time, you don't have to give up hope. Just because it's always been there doesn't mean it can't resolve. So that's the main thing. I just really want women to advocate for themselves. I want them to trust their instincts. It is important to listen to a doctor, and I think doctors do have our best interest at heart. But if something is not instinctually correct for you, go get a second opinion. I think it's really important. I worry about people who don't have insurance, because it's really easy for me to say, and I even have kind of crappy insurance. And that's been frustrating, because I used to have like way better insurance. Now I kind of have not good. Anyway, and I think and I at least have some, people who don't, I think that's scary, and that's hard. My heart breaks for those people. But if you have an outlet, don't give up.
I love it. You have to be your own best self-advocate, right? It's true.
It's really important, especially for women. And I certainly don't want to get on a whole man bashing thing here, but I do find that the studies for women's health is lacking, really not just for gynecological and reproductive issues, but just our bodies are different than men's bodies. Of course, we want to be treated equally, but that's kind of my point. Like, the research for us is not the same. Everyone assumes if you study the male body, well, it's just the same for the female, except for the reproductive parts, and that's not accurate.
Completely agree, Paige. Pelvic pain in general, the pudendal nerve, endometriosis, infertility, really understudied, underdiagnosed, undertreated, studied, and research in the NIH. We were making some changes in the past couple of years, just putting more money research towards it, but it's complicated. There's a lot that we don't know as healthcare professionals, and the connection with the hormonal aspect and the nervous system and the organ system. There's just a lot that we're all still learning, right? So you're right. We need to focus more. There needs to be more dedicated research thrown at it, and just a deeper level of understanding and just diagnostics, I think, in this area.
Yeah. Well, thank you for all you're doing. I hope we meet. Are you actually in New York?
I used to be.
Where are you now?
I'm in Florida now. We moved here years ago, but I love New York. We'll always love it.
Well, if you come for a visit, look me up. We'll hang out.
I would love to meet you in person, and you're just fabulous. And thank you. Keep doing it. Keep raising awareness. I can't even tell you how much I'll appreciate what you're doing. So keep going.
Thank you so much. Thank you for all you do. It
Take
was
care.
wonderful to talk to you.
You too. Take care. Bye.
Bye.